Hey there, Dr. Mark McCawley from McCawley Periodontics, and I've got some patients asking, what should I look for in a periodontal examination? Well, a periodontal examination, it takes a little while. There's several steps to it, but one of the most important things is you check for bone levels. That's one of the main things you're looking for because periodontal disease is loss of bone. So what we look for, and we actually check for, some of these numbers right here. And these numbers are called pocket depths. They measure your bone levels. We like the numbers that are 1, 2, and 3. Those are those healthy lines right there, those black lines. When it starts to get a bit worse, we start to see some 4s and 5s. These turn red here. That's getting to be moderate gum disease. When it gets to be more severe, that is 6 and above, and it shows up as yellow striped lines. So those are some things to look out for, and that is the main thing that we're checking for. Also, something that we check for that we highly recommend that everybody check for is the actual cause of the disease, which is the bacteria in your mouth, because that's what actually causes the gum disease. And we check for it using a phase contrast microscope. On every new patient that we think has any periodontal disease, we will take a sample of your bacteria, we will examine it on this microscope right here, and we can actually isolate and figure out what could be causing this disease. Because we know there are certain bacteria that are protective and there are certain that are pathogenic. So this is an example of actually a parasite right here. This is somebody's amoeba, and that is a parasite. That is a pathogen in your mouth. That's something we want to get rid of. And this patient, we're going to get rid of them for it. So thank you very much, and give us a call. We can get you in. Thanks.